and welcome to Brewing Brilliance, a podcast where we talk to academics from across the university who are involved with the Healthy Ageing and Chronic Conditions Research Institute. We will be speaking to researchers who are leading innovative interdisciplinary approaches to promote lifelong health, delivering improved interventions to manage chronic conditions more efficiently. These sessions are essentially opportunities for us within the Healthy Ageing and Chronic Conditions Research Institute to meet colleagues from across and beyond our faculty to foster knowledge sharing, collaboration and networking. My name is Adrienne Cleverly and we are joined today by Lewis Hotchkiss. Lewis is a research officer at Dementias Platform UK, where he leads work on responsible artificial intelligence and neuroimaging within trusted research environments. Hello and welcome. Thank you for joining us today. So can I start by you telling us a bit about the importance of artificial intelligence in health and data research?
Yeah, of course. So, of course, there's lots of excitement around AI at the moment. We hear so much about it these days and we're seeing it used more and more in everyday life, but it's becoming equally important in health data research for things like diagnosis, prognosis and treatment of lots of different diseases and disorders. So AI models, a lot of the time we use machine learning techniques, and that just means that we feed in lots of data to models to be able to learn and make predictions. And so this is really useful in a healthcare scenario. So a lot of my research is using neuroimaging data to be able to train AI models to be able to make predictions on things like diagnosis of diseases. And this is really important in dementia because there's often a lot of misdiagnosis at the moment with different forms of dementia that aren't Alzheimer's. So things like frontotemporal or Lewy body dementia, they often get misdiagnosed as Alzheimer's disease. So we can use AI to be able to help us differentiate between these different forms of dementia to help patients get the right treatment for their given disease. So it's really important to be able to do that. We can also use AI for early detection and prevention of diseases as well. So there's been lots of interesting research at the moment in wearable data, so your smartwatch data. Things like Parkinson's disease has been able to be predicted years before any onset of symptoms just by using wearable data and AI. And that's really crucial in dementia where we don't have any treatment yet for stopping or preventing the onset of dementia. All we can do is sort of slow down that progression. So being able to detect dementia early is really crucial for the treatment options that we have at the moment. So if we can get AI to be able to do that, that's going to have a massive improvement on dementia care in the NHS. And there's lots of different purposes for AI in healthcare at the moment, but we've had the techniques to develop AI for years now. But it's only because we're starting to get access to large enough data sets that we can actually train good and robust models, which we can implement into clinical practice now. And that's mainly been possible due to trusted research environments, bringing together this health data and making that accessible to researchers to be able to train and develop AI models on.
Little bit of a strange question, but you talk about training them.
Yes.
Do they develop on their own then? Do you have to put boundaries in to stop that sort of growth, or is that part of what the trusted research is?
Well, so AI models, as most techniques we use are machine learning techniques. So you'll often give it data, and if we're doing something like a classification, so classifying people who have dementia against people who are healthy controls, what we would usually do is feed in some data and give it a label and say, okay, so this brain scan relates to someone who has dementia. This brain scan relates to someone who's healthy and doesn't have dementia. So we give the machine learning model lots of different examples of data and what the actual labels are. So the model can learn how to make predictions of the label based on the data that we give it. And so from that, when we give it new data that it hasn't seen before, it's able to predict what that label is going to be. So we can feed it a new brain scan after we've trained the model to learn how to make those predictions. And it's able to classify whether someone is likely to have dementia or is healthy.
It's very relevant as well, isn't it? Because like you said, artificial intelligence or AI is just such a hot topic at the moment, isn't it? So can you just explain a little bit about the data in the trusted research environments?
Yeah, of course. So trusted research environments are basically a way to be able to bring together data sets and share them in a safe and secure way. So most of these TREs are built upon the 5 Safes framework. So that means safe people. So accredited researchers are accessing safe data, which is pseudonymized. So we make sure to de-identify the data first. Their projects are safe and within the public benefit, and that the outputs from that research are checked check to ensure that it's not disclosive in any way. And so it's that robust governance and technical infrastructure that surrounds trusted research environments, which provides data owners with the confidence to be able to hand over their data to these TRVs to be able to share them, because that data is being accessed within a safe and secure setting, often within like a virtual machine or on their own desktop. So that data can never leave that virtual machine, but they can still access that data to be able to run their analysis. So as an example, I'm from Dementias Platform UK, and we have the Deep UK data portal. So we bring together over 60 cohort and clinical data sets from across the UK, but also other countries like France and Korea, Australia. And that contains over 3.5 million subjects worth of data, covering lots of different modalities, things like blood data, genomics, neuroimaging, but even questionnaire data on things like lifestyle, diet, and exercise. So, really comprehensive data on millions of subjects, all in one place for researchers to access. So that is a really beneficial for just health data research in general, but even more crucial for AI models, where we do need lots and lots of data to be able to train these models to be able to make predictions. As I say, we've had lots of AI techniques for ages to be able to make these predictions, but data's often been siloed and shut off into separate organizations. It's been really difficult to get access to that data to train these models. But now we have a way to do that in this safe and secure setting. And it's not just Deep UK that does TRVs. There's the Sale Data Bank, which hosts the NHS Wales data. NHS England is also setting up their equivalent of secure data environments, which are essentially the same thing. And places in Scotland, and any sort of data is starting to be shared through trusted research environments. So they're going to be really crucial going forwards, especially for developing AI models.
So with that amount, because you just gave some massive numbers of things there, what are the main, is that one of the concerns, or is that one of the main concerns, or is that nothing concern-wise, there's nothing there? Would you say that, sorry, I totally overworded that. Would you say that's one of the main concerns, or is something else more of a concern within this?
So, there's lots of concerns when it comes to AI models. And one of them is privacy, of course. And the main job of us in trusted research environments is to keep the data private and secure. And when you're training AI models on so much data about an individual, that can become very disclosive. The data we use is de-identified. So we remove anything like names and addresses, phone numbers, anything that's directly identifiable. But when you think about it, when you combine enough data about an individual, they can be identified by combining enough data, or even linking to external data sets or sources. So that's one of the issues in AI models. Of course, it's not an issue within the trusted research environment, because it's safe researchers using data in this safe setting. The concern lies when we want to take these AI models out of the trusted research environment to be implemented into clinical practice, or to validate on external data sets, or fine-tune even further. So to be able to do that, you often need to take the model out of the trusted research environment. But AI models have a lot of inherent issues with that, because they can actually contain information about the data within the architecture of the model. All the models can even be attacked to be able to infer or reconstruct the original data that was used to train the model. So of course, in TRVs, we don't want to be releasing AI models out into the public domain, which have the potential to leak or disclose data about the individual's data that we have within the trusted research environment. So we have to be really careful about how we let out these models from the trusted research environments, and how they're used to ensure that they are being used in a safe way and in a responsible way. So privacy is one of an issue in AI models and data. But of course, we have a load of other issues. The UK set out their AI roadmap for how AI should be regulated. And that mainly comes down to responsible AI principles. So one of those is privacy. The other crucial one is bias and discrimination. This is a massive issue at the moment in AI models, because even though we do have lots of data for training AI models, they mainly come from white European populations. So people from ethnic minorities can often be disadvantaged by the AI models that we're training, because it hasn't really learned how to deal with that kind of data if it hasn't seen it before. Yeah. So we have lots of issues with bias and discrimination in models, and we can't implement these models into practice unless they are fair and don't discriminate against any particular individuals. So to be able to do that, we need to be able to build more diverse and representative data sets, which is a massive challenge. But we really need to be able to collect more data on different populations and different ethnicities, so that we can build more robust AI models, which can handle lots of different cases of populations. And the other main issue is transparency and explainability in AI. You often hear that AI models are black boxes. You don't know what's gone into them, how it's come to a conclusion, how it works. But it's really important if we're implementing AI models into clinical practice that the clinicians understand how a model is coming to a conclusion. They're not just given a binary decision. So we can actually incorporate explainability into AI models as well in that case, so that you can explain how a model came to its conclusion, which can really help in guiding a clinician in making their final decision, depending on what their AI model has been designed for.
Apologies in advance for this question, but with a lot of AI in terms of technology generally, it can get outdated quite quickly. Is that something that comes in as like an issue for what you're trying to deliver, or because of how you've trained it and how you've programmed it, it just doesn't even...
The issue is probably the data becoming outdated.
Right, okay.
Once you train an AI model, I think it's more about keeping the data up to date. So you can, once you have a model which has been trained, you can fine tune it even further afterwards, so that you can incorporate new data and new knowledge into that model as you collect more data, as you collect more information, and that improves the model then and its decisions and predictions that it's making.
So, sorry, I went a bit off topic then, but how do you trust then? Because you talked a lot about the privacy as one of the main concerns, and it was a big concern across a lot of different models. How do you trust that privacy in this environment?
So we were actually funded last year by Dare UK to set up an AI risk evaluation group. And this was to bring together lots of different stakeholders to understand what the concerns were with AI models and how we can ensure that they are protected and safeguarded within trusted research environments. So we had discussions with members of the public to understand what their concerns were with training models on their data, but also with researchers to understand how they felt implementing different safeguards and mitigations into their research to ensure that that data was protected. And importantly as well, we had discussions with data owners themselves to see how we could actually assess models to see that they were safe and private enough to be released outside of the TRV or to be used in different scenarios. And so from that, we were able to build quite a robust governance framework for enabling AI models to be trained safely. One of the main things that came out of that was the use of privacy-preserving techniques in AI models. So there's lots of different techniques that we can use to protect the privacy during the training stage of an AI model. Something like homomorphic encryption that allows you to learn the data on make the model learn on encrypted data rather than the data itself. Yeah. But that is actually very challenging to implement for a lot of researchers, and a lot of researchers weren't really happy with that solution. So then there's other techniques like differential privacy, where you essentially add some noise into the original data. So it's not exactly relating to individual people, you add a bit of noise into it. So that can be used to train the model. Or we can use synthetic data versions of the original data, where we can create a synthetic version of our data sets with those privacy guarantees in place, so that we're not using the actual data, but we have enough characteristics of the original data set that we can still make meaningful predictions from that data. So those are some of the privacy-preserving techniques. But ultimately, it came down to we shouldn't really be releasing these models anyway. Yeah. We should be trying to keep them within the trusted research environment as much as possible, rather than allowing them to be released. So there's three main reasons why researchers may want to release their AI model. One of them is for open and reproducible science. This is a big issue in science anyway, but even more so in AI research. Not many people actually publish their AI models alongside their papers and academic work. So we really need to encourage that. But by putting your AI model out in the public domain, then that has the risk of being attacked and leaking data and so on. So that's an issue. So, researchers may want to share for that reason. Another reason, as I say, is they may want to validate that model on different data sets, or fine-tune it on other data sets which aren't in the original TRE. But in that case, we can actually use federation technologies. So over in the data science building at Swansea, a lot of work is being done to develop federation technologies so that we can connect lots of different trusted research environments and organizations, so that we can actually do research without that data ever having to leave the original TRE. So we can connect Deep UK with the Sale Data Bank or with the Scottish TRE to be able to access lots of different data, but still within the trusted research environment. And so that means that we can use external data sets for validation or fine-tuning without that model having to ever leave our trusted research environment. So that's really crucial. And the other one is the actual implementation of these models into clinical practice. How can we actually ensure that these models are, if they're going to be implemented in the NHS, that they are kept safe and secure? And we're starting to build the infrastructure on how we can actually allow models to be hosted within our trusted research environment and to be able to be queried externally in a safe way, so that you can still make predictions, but the model is still kept safe and secure within our servers. So we're trying to, develop a lot of solutions to be able to enable AI to actually be used into practice and to enable open and reproducible science as well, which is
and
crucial.
Creating endless opportunities for research, essentially.
Well, yeah, exactly. It's being able to access so much data is really crucial, not just for AI, but any type of health research.
You did mention synthetics earlier. Can you just explain a little bit more about that for us?
Yeah, so synthetic data is quite an interesting privacy-preserving technique, and it's something that we're looking to explore more in Deep UK. We literally just got some funding as well to explore the use cases of synthetic data and how we can use it in trusted research environments, because there's a lot of interest at the moment in this. So synthetic data essentially allows us to create fake versions of the data. And you get different levels of synthetic data. At the lower end of the spectrum, you have just completely random data. So you may want to generate data within a certain value range of the original data. Say you've got age. You want to generate ages between 20 and 80, which are within that value range. So you can use synthetic data for that purpose, but it doesn't really have much utility. Higher up you go in the fidelity levels, you can create kind of statistical synthetic data, which maintains the kind of statistical properties of the original data while maintaining privacy. And one step further, at the higher level, you have like correlated synthetic data, where it maintains the relationships between the different variables in a data set. And so these different levels of fidelity have very different purposes and use cases. One of the issues at the moment we have is researcher training. So if we're training researchers how to analyze health research data, they don't actually have an awful lot of data that they can access openly for researcher training. Even teaching on a master's course is really difficult because we don't really have open source data sets being able to teach how to actually analyze health data. So we can create synthetic versions of our data sets specifically for researcher training, so that they can be so that researchers or students can access synthetic versions of the data for training purposes before actually getting access to the data itself. So that's a really important use case because, as I say, there's not much data available to do that at the moment. And it's really hard to be able to get access to data sometimes if you're a student or you're just starting out in research. So that's really crucial. But the other part as well is being able to train safe AI models. If we can create high fidelity, so good quality synthetic data, which maintains privacy, that can be really useful for training private AI models, which aren't using the original data, but are still able to make good quality predictions. But even more interestingly, we can create synthetic versions of less collected data. So to go back to the example I gave at the beginning about differentiation between different types of dementia, well, actually, we have lots of data at the moment on Alzheimer's disease, but not so much on frontal temporal or Lewy body dementias. These are other less common types of dementia, which makes it really difficult for training AI models because there's an imbalance issue. We have a lot more Alzheimer's patients compared to others. So when we're training AI models, they're often biased towards making Alzheimer's predictions. So then we have the bias in that. But we can use synthetic data in that scenario as well to be able to boost those samples of those, less common diseases, so that we can balance our data sets to have equal number of patients within each of those different subtypes of dementia, to be able to improve our AI models so that they can differentiate a lot more accurately between these different types of dementia. So synthetic data has lots of wide-ranging potential, and it's something that we're exploring more and developing tools and governance in Deep UK to be able to solve, so that we can actually use synthetic data in practice for all these different purposes.
It's incredible. And to think about how fast-paced this sort of type of research moves as well.
Yeah.
I'm sorry to say this, but you're going to have to come back and update us, because this is going to change so much in short periods of time, isn't it?
Yeah, of course.
Unfortunately, that's all we've got time for today, even though I've got so many more questions to ask you. And I'm sure you've got a lot more to say.
Always.
Thank you so much for joining us and giving us an insight into this field of research. For more information about data science and EP UK, you can visit the Swansea University website. If you've enjoyed listening to some of what Lewis has told us, and I'm assuming Lewis has only touched on it, you can find out more about this podcast and the Swansea University research by going to Swansea University. We are under the Medicine, Health and Life Science Research Institutes under the Healthy Aging and Chronic Conditions. Lewis, thank you so much for that.
Thank you for having me.
That was so interesting. Thank you.